Welcome everyone to another wonderful episode here at Jaws of Podiatry. We have a very young patient who presents to our office today with multiple chief complaints. I'm only going to present the right foot. The left foot is essentially identical. Young patient who has been battling this for how many years? 11 years, ladies and gentlemen. Half of my lifetime. Which makes me 22 years of age. I like this case a lot because there's a lot of different clinical presentations that a lot of people battle. We are not going to be doing anything, you know, the good old saying, if it ain't broke, we don't fix it. So we won't be doing anything with the bunion. Of relevance, right? People cannot really tell because the patient is non-weight bearing. And of course, the suntan is there because the foot is already sterile. So the patient has a very long toe, second toe. In addition, extremely unsightly, and we're going to tag those pictures as well. Unsightly corn, and unsightly corn. On the left foot, it's going to be essentially the same, but it's not the fourth, it's the third. And also the toe is crooked, right? It's crooked. Can you see that there, Caesar? It's crooked. So we're going to uncrook the toe. And in addition, last but not least, we're going to go ahead and remove a little toe tuck. We'll go ahead and remove the little pouch. It's actually bigger on the other side on the second toe. So we're going to put a standby to this, and then we're going to present the final outcome. We have Dr. Nunez somewhere. Anyways, let's get to work.
A few inches later.
Okay, so we're all done. Continuation, part 2. Is Dr. Nunez okay? Okay, everyone. The transformation has been completed. We have finished, as mentioned before, multiple clinical presentations. The patient originally was not happy with the length of the toes. Second digits, ugly corns, crooked toe. Am I missing anything? That's pretty much it.
Yeah, you got it.
And then we had a raised toe, which we also fixed. I'm gonna go ahead. I'm holding with my left hand, holding the second toe. Again, we don't use any pin screws or plates. Office-based surgical suite. Patient is wide awake. Patient will walk in. Has walked in. Will walk out. And I'm going to go ahead and present the left foot, okay? I'm holding the toe in what we call the short compressed, position. That's where it's going to be. We follow the rainbow, the parabola, so to speak. The toe's already swollen, so, and how can we forget the toe tuck, right?
Toe tuck.
That's it, right? So wherever you see here, this toe was raised up. We brought it down, okay? Right here, unsightly corn, and I'm gonna go ahead and show you guys there. One ugly corn here, another ugly corn, and then right here, the toe tuck. You can see that the tip of the toe is nice and symmetrical, very natural contour. And basically, we did the exact same thing. You guys can tell here, right? Same thing. Nice and short, really nice. It already has some antibiotic cream. We're ready to, put everything, all the bandages in place. Very intricate process, to say the least. I called it, we'll say the 20-80 rule. 20% is what we do in here, and then 80% from this point forward falls on the patient, so to speak. We're seeking compliant patients that will really truly embrace the investment, which is this is exactly what it is. We're not going to talk about, again, social, psychosocial elements. how this has affected the patient in the last blank years. So, I think that all in all, this has been a really, really nice case. Like I said before, the small in what we do, the good old saying, every millimeter counts. And it really is true. The patient, not sure how, was able to watch the entire procedure without not, feeling wheezy or not even passing out. But it was quite the experience, I suspect.
Yeah.
Right? So I think this is a very, just like every other story, a very compelling story. The transformation is absolutely wonderful, even with the stitches there. Long toes will be around for a very long time. Ugly corns will thrive and survive. Fact, I speak the truth. And, I think, definitely, this is one of those cases that I think is worthy of definitely, doing like either, weekly or, every couple of weeks put out a case update. Patient lives in Miami, which is a great thing. That's why we can, be able to do that and really get some great footage as well. Got it? Footage. Caesar is dying to laugh. Maybe. He just wants to, it's Friday. He just wants to be out. As always, we will continue to do what we do. We will continue to educate the world. One second. I'd like to take this opportunity to thank the patient for allowing us to do this video segment. Very well appreciated. I'd like to absolutely thank Caesar the Great, doing what he does best. And last but not least, Dr. Nunez, El Maestro, the professor. You don't have to. Is there anything that you would like to add or say?
Well, I'm absolutely happy with this transformation. For 11 years, I've wanted to change this, and it's truly like a huge impact in my life because, like you mentioned, socially, I'll be able to wear. I'm excited to wear sandals and heels and open-toed and everything. So it's definitely a boost of confidence, and you guys did an exceptional job, and I'm so glad that I was able to see it. So thank you, doctor. You're thanking me. I should thank you.
Well,
I'm super happy.
On behalf of the entire organization, including Dr. Nunez, we really appreciate all those kind of words. Not bad for the first day of work, right? It's a joke.
I know.
It's but it's you.
We do enjoy what we do. Can't you guys tell? Anyways, anything else? That's it. We're done. We're good. Everyone, I'm going to definitely upload this today, so everyone have a wonderful weekend.